In this video, I'm going to introduce you to the stainless steel crown technique, also known as a Hall crown technique, as an excellent way to manage tooth decay in children. Maybe your child is about to have a stainless steel crown placed, or you're doing some research, or you want to show your child what it involves at the dentist visit. Well, this video will cover all of that so you can get some confidence either for yourself as a parent regarding some treatment your child's about to have, or the child can get some confidence before they can go into the dental practice to have their treatment. My name is Jaz Gulati from the UK, and I'm making this educational video to give more information about concerned parents about this stainless steel crown technique. I've also got some other educational videos, including how to get your child to brush their teeth, so check that one out if you haven't already. When a child is diagnosed with tooth decay, it's a tragic thing. It's not nice. Look, it's a preventable disease, and the pillars of it is regular toothbrushing with a fluoride toothpaste and controlling how much sugar there is in their diet. And more important than how much sugar they have is how many times in a day sugar enters their mouth. Now, I'm going to do a whole other video about how to enjoy the sweet things in life without getting tooth decay. But let's just focus on your child has been diagnosed with tooth decay, and a dentist has potentially suggested to you to use a Hall crown technique or a stainless steel crown. This option is available when the decay isn't too deep, so it's not too close to the nerve, and this technique is special because it requires less cooperation from the child. So unlike adult crowns where you need a lot of cooperation from the adult, lots of drilling, in a children's crown technique there's hardly any, if none, drilling at all, and it's very different to a filling. So when you're doing a filling, you have to first remove the decay, drill, sometimes you need anesthetic, and then a filling is placed. The problem with traditional fillings in children is that in children who have high risk of tooth decay, so someone who is getting lots of tooth decay and potentially is a reason why they need the crown in the first place, that these fillings are roughly around about 50% successful at 3 years. 50%. That's terrible, okay? This is because when you're treating a child, there's a tongue in the way, there's a cheek in the way, there's saliva in the way. You can do only so much in terms of high quality treatment. And of course, the mouth is a very hostile environment. The kind of things that children are eating today, highly acidic foods, and the teeth grinding that children do mean that these fillings are often not very successful. What is successful is these children's crowns, or these Hall crowns, or these stainless steel crowns. Lots of different terms for them, but essentially these are 94% successful. So as a way of managing tooth decay or cavities or holes in children's teeth that are fairly sizable, then the first choice should be a Hall crown or a stainless steel crown. Whereas if you've got small holes, then fillings can still be quite successful. These children's crowns come in preformed sizes, so we pick a size that's the best fit for that child's tooth, and we fill it up with this special cement, and the beautiful thing is there's no drilling involved, and we get the child to bite onto it, and that seats it in position. So if you look at the example here of placing a children's crown, and then just a few months later, we notice how the bite has fixed itself. So although it might feel funny to your child initially, they do acclimatize really quickly. Children are great at adapting. The science behind how these children's crowns work without any drilling is that once you seal the tooth decay doesn't have access to the sugar anymore, and it can't breed and it can't continue the tooth decay. So once you deprive the bacteria inside the tooth of nutrients, the decay stops. And that's how this technique can be incredibly successful. And of course, the fact there's a metal crown on the tooth is a strong material and it's incredibly successful. Now, the most important question I get from parents is that what happens when the baby tooth, it has its time to go and it needs to get loose? Will the crown interfere with the adult tooth? Well, the answer is no. The roots get resorbed away and the crown comes away just like a normal baby tooth when the time is right. The way I tell children is that it's a pirate tooth or a princess tooth, and they are very accepting of it and they learn to like it and they learn to love it. It's no big deal at all. The biggest challenge I have is explaining this technique to parents. Look, I get it. It's a not a nice thing to have with tooth decay, and then you don't want to have this stigma of the other parents in the playground knowing that your child had tooth decay. It's almost like you blame yourself. So you almost don't want to share to the world that your child had tooth decay. But listen, my biggest mission here is how to get this baby tooth to last till age 12 or beyond, when that baby tooth, for example, a baby molar, needs to then be lost. If your child is 7 or 8, and a filling is not going to cut it, or your child's not cooperative enough and they need to lose that tooth instead, then I'd rather try and save these teeth. And the best way to save these teeth is often a silver crown or a stainless steel crown. So we need to sometimes put our ego aside and accept that what is best for the tooth may not be the most aesthetic thing there is, but it's something that's incredibly successful and hopefully means that your child will have more success, less visits to the dentist, less experience of pain, and an overall positive experience of their dentistry. Children often need one, sometimes they need multiple. This is something to discuss with your dentist. It's not always the best thing, so every child is different. Make sure you listen to your dentist's advice as to what they advise, but this video is primarily to motivate you. If you're a parent and you've been told that your child would benefit from a Hall crown technique or a stainless steel crown, I'm hoping this video and showing a child getting fitted with this crown will benefit your child and your mindset about what's to come. I hope this video helped you very much. If it did, please hit that subscribe and like button, and I look forward to making more educational videos for you.